White spots on the nails are known as. Answers: A. Onychotrophia. B. Leukonychia. C. Hang nails. D. Onychoxis. The answer is B. Structures that are appendage to the skin are hair, sweat glands, oil glands and. Answers: A. Sensory fibers. B. Blood vessel. C. Nails. D. Motor fiber. The answer is C. Patron will respect and be loyal to a manicurist who is. Answers: A. Illiterate. B. Courteous. C. Sullen. D. Arrogant. The answer is B. What kind of chemical is flammable? Answers: A. Cuticle cream. B. Hand lotion. C. Enamel. D. Cuticle solvent. The answer is C. What is the last step for man manicure? Answers: A. Apply nail bleach. B. Apply white nail polish. C. Apply dry polish. D. Apply nail polish. The answer is C. If patron's hands have ringworms, what should you do? Answers: A. Refuse to give service for client until it is solution healed. B. Keep on working. C. Apply antiseptic. D. Wash patron's hands with disinfection. The answer is A.
The Nail Exam app. Ace the nail exam on your first try. Available on App Store.
Buffing the nails with pumice powder is used to treat. Answers: A. Pterygium. B. Leukonychia. C. Corrugation. D. Onychophima. The answer is C. While performing a manicure, the technician accidentally cut into client's skin. What should he or she do immediately? Answers: A. Stop the service and refer the client to a physician. B. Sanitize the skin and apply an antiseptic. C. Wash with warm water and continue the service. D. Note the incident in the client's file. The answer is B. To push back cuticle you should use. Answers: A. All of the others. B. Cuticle pusher. C. Steel pusher. D. Metal pusher. The answer is A. The manicurist can help in protecting the client's health by conducting the best. Answers: A. Sanitary practices. B. Professional techniques. C. Cosmetic product. D. Professional instruments. The answer is A. The active agent in nail bleach is usually. Answers: A. Soap. B. Water. C. Detergent. D. Hydrogen peroxide. The answer is D. Watery blisters and thick white skin between the toes are signs of. Answers: A. Onychia. B. Pterygium. C. Pedicuring. D. Athlete's foot. The answer is D. For a more natural effect, the shape of the nail should conform to the. Answers: A. Cuticle. B. Skin texture. C. Fingertips. D. Hand. The answer is C. What kind of curing agent do you use when applying gel nails? Answers: A. Ultraviolet light. B. Infrared light. C. Blue light. D. Red light. The answer is A. Why do you have to fill acrylic nails? Answers: A. Because the nail turns green. B. Because they lift. C. Because the nail is split. D. None of the others. The answer is B. Before trimming the cuticle, what do you do? Answers: A. Apply cuticle solvent. B. Apply base coat. C. Apply cuticle oil. D. Apply acrylic nails. The answer is A. To remove old polish on artificial, what should you use? Answers: A. Alcohol. B. Nail solvent. C. Non-acetone polish remover. D. Acetone polish remover. The answer is D. What is the sign of fungus or mold? Answers: A. When the nails turn into yellow or green. B. When the nail is broken. C. When the nail lifts. D. When change the polish. The answer is A. To remove artificial nail, what do you use? Answers: A. Quartz. B. Nail solvent, acetone. C. Alcohol. D. Cuticle remover. The answer is B. What is the benefit of acrylic nail? Answers: A. Strengthen and lengthen the nail. B. Make nail grows slower. C. Cover up an infection. D. Make nail grows faster. The answer is A. How long do you immerse your client's feet in antiseptic when doing pedicure? Answers: A. 5 minutes. B. 15 minutes. C. 2 minutes. D. 10 minutes. The answer is A.
The Nail Exam app. Ace the nail exam on your first try. Available on App Store.
Why does acrylic nail lift easily? Answers: A. Client's hands are wet. B. Manicurist applies acrylic on cuticle. C. Apply primer after applying powder. D. Client changes polish at home. The answer is B. Why do you have to discard the emery board after used? Answers: A. Cannot be sanitized. B. Bad. C. Coarse. D. Thin. The answer is A. When you apply acrylic nails, what is the use of the primer? Answers: A. Strengthen nails. B. Remove stain. C. Mending. D. Bonding. The answer is D. To remove callous skin during a pedicure, use buffer with. Answers: A. Alum powder. B. Pumice powder. C. Laundry powder. D. Baking powder. The answer is B. What is the benefit of paper wraps, mending tissue? Answers: A. Strengthen the nail. B. Helps the nail grow faster. C. Smooth nails. D. Cover wavy ridges. The answer is A. Shaping is most often done before of the nail bath, as. Answers: A. Most patrons' nails are already clean. B. Filing is more difficult on damp nail. C. Filing is more difficult on dry nail. D. Filing is less difficult on damp nail. The answer is B. What product contains nitrocellulose? Answers: A. Hand lotion. B. Enamel. C. Soap. D. Polish remover. The answer is B. Where do you find lanolin and emollient? Answers: A. Hand lotion and cuticle cream. B. Alum solution. C. All of the others. D. Oil and polish. The answer is A. What do you use to remove foot calluses? Answers: A. Emery board. B. Nail clipper. C. Foot file. D. Cuticle nipper. The answer is C. What do you use to wipe, to clean, the manicure table? Answers: A. Alcohol. B. Soap. C. Disinfectant. D. Water. The answer is C. What do you need to do before doing an artificial nail? Answers: A. Discuss with the customer. B. Make record card. C. Set up table. D. All of the others. The answer is D. What happens when the acrylic nail is immersed too long in water? Answers: A. Fungus growth and infection. B. There will be infection. C. There will be itching. D. There will be fungus growth. The answer is A. Warming the solvent to 105 degrees speeds removal time for removing artificial nail enhancement by. Answers: A. 60%, B. 50%, C. 75%, D. 30%. The answer is D. To avoid responsibility of client's allergy to a product, you have to. Answers: A. Establish a health record card. B. Suggest self-treatment. C. Treat it with medicine. D. Refer patron to a physician. The answer is A. To save an emery board in a plastic bag for each client after service due to the growth of. Answers: A. Bacteria. B. Spirilla. C. None of the others. D. Mildew. The answer is A. If the client has callus, which instrument should not be used? Answers: A. Foot file. B. Credo knife. C. Nail brush. D. Pumice stone. The answer is B. What is the contraindication for application of artificial nails on a customer who never wear artificial nails before? Answers: A. Low sensitivity to artificial nails. B. None of the others. C. No sensitivity to artificial nails. D. High sensitivity to artificial nails. The answer is D. What do you use mending paper for? Answers: A. Covering nail surfaces. B. Covering some spots. C. Covering wavy ridge on nail surfaces. D. Repairing split nails. The answer is D. What is leukonychia? Answers: A. Yellow spot. B. None of the others. C. White spot in the nail body. D. Blue nail. The answer is C. What is catalyst? Answers: A. It is an ingredient that speed up the hardening process. B. None of the others. C. It is an ingredient that slows the hardening process. D. It is an ingredient that makes the hardening of the polymer. The answer is A.
The Nail Exam app. Ace the nail exam on your first try. Available on App Store.
While cutting excess cuticle around the nail, you accidentally cut the client's skin so that it bleed. What should you use to stop this bleeding? Answers: A. Alcohol. B. Powder alum. C. Acetone. D. Non-acetone. The answer is B. What would you do when glue overflows onto the skin in the application of nail tips? Answers: A. Stop. B. Stop and clean up the glue with polish remover. C. Remove tip. D. Apply base coat. The answer is B. A manicurist license entitles the license to do all except one of the following. Answers: A. Handle appointment book in an establishment. B. Manicure in barbershop. C. Manicure in salon. D. Remove rollers on client's hair when not busy. The answer is D. The white spot at the free edge of the artificial nail tip is. Answers: A. Nail plate. B. Balloon. C. Air bubble. D. None of the others. The answer is C. Where does glue overflow? Answers: A. Nail mantle. B. Nail groove. C. Nail body. D. Nail plate. The answer is B. If you open a salon, the first requirements for the Board of Barbering and Cosmetology approved are. Answers: A. Business license. B. Skin care license. C. Manicure license. D. Cosmetology license. The answer is A. To remove acrylic from a patron's nail, it is best to. Answers: A. Use metal pusher to pry them off. B. Use cuticle solvent on the nails. C. Let the patron soak her nails in acetone. D. Patron soak her nails in non-acetone. The answer is C. Leaving the cap off the acrylic nail liquid container will. Answers: A. Cause the product to increase in volume. B. Cause the nail to be hard and brittle. C. Cause the product to be easier to apply. D. Cause the product to evaporate. The answer is D. A person with manicuring license is allowed to work with. Answers: A. Arms and hair. B. Nails and hair. C. Nails and face. D. Hands and feet. The answer is D. How do you remove acrylic nail if client do not want to wear them anymore? Answers: A. Polish remove. B. Acetone. C. Alcohol 99%. D. Quartz solution. The answer is B. Which of the following conditions you cannot give service? Answers: A. Scar. B. Lesion. C. Canides. D. Furrow. The answer is B. Who is not responsible for sanitizing manicuring implements? Answers: A. Manager. B. Owner. C. Receptionist. D. Consumer. The answer is D. What is the technical term for split or brittle nail? Answers: A. Leukonychia. B. Onychorexis. C. Hangnail. D. Pterygium. The answer is B. Which of the following is a germicide? Answers: A. Alcohol 70%. B. Phenol 5%. C. Formalin 2%. D. Pine oil 60%. The answer is A. When performing a pedicure on a client, you notice that his feet are full of water blister. You answers: A. Pop break the blisters. B. Continue with the service. C. After the massage, wrap the feet in hot towel, saturate with an antiseptic. D. Refuse to work on the feet until the condition is healed. The answer is D.
The Nail Exam app. Ace the nail exam on your first try. Available on App Store.
Each establishment shall post. Answers: A. A list of current prices for services. B. Owner's name and address. C. A copy of the sanitary rules. D. A list of service and price. The answer is C. During the application of artificial nails, after applying tips on natural nails, what is the next step? Answers: A. Apply top coat. B. Apply base coat. C. Nail polish. D. Add more glue. The answer is D. When working on the male customer's nail, what do you use to hide spots? Answers: A. Nail bleach. B. Nail whitener. C. Polish remover. D. Base coat. The answer is B. When primer touch the skin, how do you feel? Answers: A. Itching. B. Burn and irritation. C. Burn. D. Irritation. The answer is B. The ending process of acrylic nails, it is called. Answers: A. All of the others. B. Polymerization. C. Catalyzing. D. Reaction. The answer is B. What is the chemical structure of acrylic powder? Answers: A. It is a combination of group-up polymer and catalyst. B. It is a combination of powder and liquid. C. It is a combination of monomer and catalyst. D. It is a combination of polymer and monomer. The answer is A. When an artificial nail tip is not well applied, what may you see? Answers: A. Both air pocket and air bubble. B. Air bubble. C. Balloon. D. Air pocket. The answer is A. What is the color of a primer when it is dry after being applied on a nail? Answers: A. Gray. B. Yellow. C. White. D. Chalky white. The answer is D. If two containers have same color of chemicals but they are different substance, you should. Answers. A. Label each container if know the of chemicals. B. Discard all of them. C. Just use it. D. Read MSDS. The answer is D. If you want to take off acrylic nails, you should. Answers. A. Immerse fingers in water. B. Soak nails in acetone. C. Immerse fingers in alcohol. D. Immerse fingers in polish remover. The answer is B. What are the signs of athlete's foot? Answers. A. Blister and fissures. B. Swelling foot. C. Callus. D. Corns. The answer is A. If the customer has athlete's foot, refer the client to A. Answers. A. Podiatrist physician. B. Pediculosis. C. Pedestrian. D. Dermatology physician. The answer is D. To use a registered EPA disinfectant to disinfect implement, you should. Answers. A. Immerse implements include handle. B. Immerse the tips of implements only. C. Immerse the handle of implements only. D. Immerse haft of the implements. The answer is A. It's important that when you're repairing acrylic or use the chemical such as primer, acetone, you must let your customer. Answers. A. Close the eyes. B. Turn the customer head to the outer side. C. Wear safety glass. D. Tell the customer look up the ceiling. The answer is C. After you finish the acrylic nail, you should. Answers. A. Discard both liquid and powder. B. Mix them together, then use paper towel to wipe and discard the neutralized product. C. Put them back to the container. D. Keep using on another customer. The answer is B.
The Nail Exam app. Ace the nail exam on your first try. Available on App Store.
What action will dilute the powder? Answers. A. Mix liquid and powder. B. Mix liquid with alcohol. C. Mix liquid and powder in water. D. Mix powder with alcohol. The answer is A. What would you do to the wet sanitize? Answers. A. Dump them after using on one customer. B. Keep the lid on at all time. C. Discard them after used on 5 customers. D. Wait until end of the day and discard them. The answer is B. Light bulb used for the manicure table is. Answers. A. 40 watts. B. 60 watts. C. 75 watts. D. 120 watts. The answer is A. Client with sensitive skin generally show allergic symptoms after repeated exposure for Answers: A. 15 days to 1 month. B. 4 to 6 months. C. 2 to 3 months. D. 7 to 9 months. The answer is B. When the nail tip is larger than the real nail, you can adjust it by using answers: A. Cuticle pusher. B. Scissors and file. C. Cuticle nipper. D. File. The answer is B. What is the use of primer? Answers: A. It is used as tape. B. None of the others. C. It is used as glue. D. It is used as bonding substance. The answer is D. How long after application of the artificial nails you can fill them? Answers: A. 3 weeks. B. 1 week. C. 2 weeks. D. 1 month. The answer is C. How do you hold the nail tip for application? Answers: A. Upward. B. Backward. C. Downward. D. Forward. The answer is C. Supplies which come into direct contact with a patron and cannot be disinfected shall be. Answers: A. Soaked in alcohol. B. Used as often as needed. C. Wiped clean. D. Disposed it in a waste receptacle immediately. The answer is D. What is the chemical structure of acrylic liquid? Answers: A. It is an acid. B. It is a monomer. C. It is a catalyst. D. It is a polymer. The answer is B. You can eat your lunch. Answers: A. In the salon. B. In anywhere in the salon. C. In the reception area. D. In the separated area of the salon. The answer is D. Cosmetologist and manicurist should not work on patrons. Answers: A. If they have a carbuncle. B. If they have a common cold. C. If keratoma is present. D. If verruca is present. The answer is B. What kind of chemical do you use to remove old polish for customer who has artificial nails? Answers: A. Polish remover. B. Acetone. C. Non-acetone. D. Non-acetone polish remover. The answer is D. The portion of the skin under the free edge is called. Answers: A. Lunula. B. Nail mantle. C. Eponychium. D. Hyponychium. The answer is D. To protect your health while doing acrylic nail, by using acrylic liquid and acrylic powder you must. Answers: A. Wear safety glasses. B. Wear contact lenses. C. Wear dust mask. D. Both wear safety glasses and wear dust mask. The answer is D. Which of the following is the MSDS items? Answers: A. All of the others. B. Permissible exposure limits. C. Control and protection measures. D. Primary routes of entry into the body. The answer is A. Where can you find out the safety information of the product? Answers: A. The MSSD. B. The MDSS. C. The MSDS, Material Safety Data Sheet. D. The SDSM. The answer is C. Giving artificial nails, the workroom must be. Answers: A. Well ventilated and light. B. Warmed. C. Have a large fan and light. D. On the second floor. The answer is A. Why do you have to file acrylic nails when it dries? Answers: A. Because they remove rough from nail's surface. B. Because they slip. C. Because they lift. D. None of the others. The answer is A. In order to apply the artificial nails, what do you use to roughen the surface of the nail? Answers: A. Fine emery board. B. Nipper. C. Pushers. D. File. The answer is A.
The Nail Exam app. Ace the nail exam on your first try. Available on App Store.
If the nail tip shows an air pocket, what do you do? Answers: A. Apply polish remover. B. Apply base coat. C. Apply to coat. D. Remove it and reapply it. The answer is D. The bulb of UV lamp should be cleaned daily and changed at least. Answers: A. Twice a year. B. Every year. C. Every 3 months. D. Every 5 months. The answer is A. When an accident happens during manicuring, 3% solution peroxide can be used for. Answers: A. Disinfectant. B. Germicide. C. Hangnail. D. Antiseptic. The answer is D. OSHA stands for. Answers: A. Occupied Safety Health Agency. B. On Safety Housing Agency. C. Occupational Safety and Health Administration. D. Occupied Safety Hazard Area. The answer is C. Linen wraps are not good service if clients' hands are usually. Answers: A. Touched. B. Held. C. Photographed. D. In water. The answer is D. The muscle extending down the forearm are called. Answers: A. Extensors. B. Both flexors and extensors. C. Flexors. D. Neither of the others. The answer is B. Which one of the following is not ground for disciplinary action by the Board of Cosmetology? Answers: A. Not comply the rules sanitary conditions. B. Performing acts of cosmetology outside licensed school or establishment. C. Failure to perform acts of manicuring after a reasonable length of time. D. Failure to display a license properly. The answer is C. Hand massage should be included with each manicure because it keeps the skin in hand. Answers: A. Smooth. B. Well-groomed. C. Flexible. D. All of the others. The answer is D. A dry nail polish paste or powder is best for the nails that are. Answers: A. Thick. B. Sculptured. C. Thin. D. Brittle. The answer is A.